Coburg is a municipality full of diversity, and it's important for us to hear the concerns and challenges from stakeholders, including service providers and community organisations.
United Spanish Latin American Welfare Centre is really proud to be here today representing the Spanish-speaking community of Victoria. This is a once-in-a-lifetime opportunity. I think for us it's an opportunity for us to outline the needs of an ageing community. Some of the issues we raised included our need for in-language support, the need for culturally sensitive support, lack of digital literacy that our elders face, also just a general lack of awareness of services within the aged care system, the experience of migrants and refugees within residential facilities and the difficulties around that. We also talked about the many issues that face our community given their histories of migration, disrupted settlement, torture and trauma, and the impacts that that has on people now as they age. So one of the really important things for us is to increase visibility, hopefully attract some further funding to support the work that we do, but also to have a broader view of how to create or promote diversity and intergenerational projects and so on.
People in more disadvantaged communities, such as in the northwest suburbs, have really suffered during COVID pandemic, and in particular, people of culturally and linguistically diverse populations. Elder abuse, by and large, is largely unrecognised, underreported and underresponded to. But when we then add that lens of migrant and refugee populations, we know that elder abuse is even more hidden. So our main message is that this is an under-resourced area and that there are difficulties getting traction in the right places to support older, culturally and linguistically diverse communities to be able to access early intervention and services associated with elder abuse, or with supports in community that are culturally sound and meet their needs. We would hope for a commitment, a long-term commitment to funding important models of care that really seek to understand what's happening elder abuse-wise with migrant and refugee populations, and so to pair interventions with research and practical interventions. This requires funding, it requires leadership, and it requires an understanding that some communities need more support than others.
We talked about the fact that a lot of older people are feeling really isolated. We talked about the fact that older people have been locked up in their homes for the last 2 years, are afraid of going out. Many older people, most of them in general, they don't really understand or know how to find information because a lot of the information is online. They don't have access or ability to access information online. My colleague Ellie, who is a positive aging officer, brought a local resident who is 92 years old. Her carer spoke about her experience in being carer with her, how hard it is and how older people don't want to complain, even though they're not being cared for very well. How older people don't actually know that there are services, that they are entitled to access services, because most of the information is in English, and people who are actually providing information don't have the linguistic and cultural capability to provide accessible and appropriate services. I talked about the project that I'm working on, which is the local partnerships supporting multicultural communities through COVID-19. And the main purpose of the project is to communicate with multicultural communities by using an intermediary as a local community member. We think that it's a good model to use across the state, because we cannot just rely on our information online. We need to use local community members. We need to be resourced and well trained and supported to do that work for us and work with us. Coming out of the pandemic, we've established some partnerships. I recommend that we should actually continue those partnerships beyond the funding that was provided because of the pandemic.
The committee will continue with a number of public hearings in regional Victoria, and then we will deliberate all evidence and prepare a report with strong recommendations to government to improve support services for older Victorians from migrant and refugee backgrounds.